Hey pole dancer, welcome to the Evidence-Based Pole Podcast. My name is Rosie Boa. I'm a pole dancer, pole teacher, and personal trainer, and I've started this podcast so that we can learn together, talk with the experts, read the research, and feel better on and off the pole. So if that sounds like something you're interested in doing, let's go. Before we hop in, I just really quickly want to come in and let you know that coming up May 17th through 19th, I have a 3-day challenge called the Pole for Pleasure Challenge. It's going to be 3 30-minute guided movement sessions. We're going to work on our strength and flexibility. We're going to learn some pole movement. We're going to, go through a whole pole pathway, actually. We're going to do some guided freestyle. So even if you've never freestyled before, I'm going to make this really accessible, really fun. I'm really looking forward to it. I've been hearing from a lot of folks that recently it's just been a struggle to have fun and enjoy themselves with pole. So let's change that together. And I'll put a link to sign up in the show notes. So I hope to see you there. Hello and welcome. Today I am joined by Dr. Hannah Sansavath, ND. Welcome to the Evidence-Based Pole Podcast. Very happy to have you. Let's start off with a little bit about yourself. So you're a doctor and you're also an aerialist and you also done pole. So let's start with your pole and aerial journey and then talk about what it is you do as a doctor and then what wisdom you bring to people who do pole and help us feel better in our bodies.
Yeah. So I actually started pole dancing my first year of med school here, naturopathic medical school. I went to Bastyr, so that was about 2017. And I was a hardcore poler for about probably 2 or 3 years. And then the pandemic hit and I started going to a different studio and kind of dipped my toes into Lyra or aerial hoop. And I've kind of expanded and started going to Emerald City. And now I just mainly do most of area apparatuses, but I still do a lot of exo and low flow pole. Love dancing in heels. Don't really do a lot of the power pole stuff anymore. I don't know, it's just, I like movement that way better. Just plinky, I graduated from Bastyr with my doctorate in naturopathic medicine in June of 2022. My specialty is physical medicine, so all things sports med, physical medicine. I do a lot of women's health and hormone management and primary care as well. But what is an ND, a naturopathic doctor? So we are considered physicians here in Washington State. I can do pretty much anything a family medicine doctor can do: order labs, imaging, prescribe medications, all that fun stuff. But the big difference is that I combine a lot of natural and alternative methods. So I might use a lower dose prescription and supplement with something that is going to help lower your blood sugar. Or, for example, for a lot of muscle injuries, I like to give anti-inflammatories that aren't NSAIDs. So like PQ, which is like turmeric, bromelain, quercetin, CoQ10. I also like to look more at the root of the problem. So instead of just, oh, my shoulder hurts, well, yeah, your shoulder hurts, but also like your shoulder is connected to your arm and also your neck. And I like to describe that as like, if you have a scarf and anything is hanging off of it, doesn't necessarily mean your shoulder is the root of the issue. It could be something in your neck, could be something in your hand or your wrist. So that's kind of how I look at things and how most NDs look at things.
So a little bit more holistic and, bringing in, other, I guess, ways of approaching medical care, in addition to sort of traditional Western medicine, I guess you'd say. Does that sound fair?
Yeah, pretty much.
And so the reason I asked you on is because I know that as a physician, one of the populations that you specialize in supporting is aerialists and pole dancers. Actually, I think we first connected I did a post a while ago where, and this may be news to some of the pole dancers who are listening here, but you're not supposed to be in pain. The normal amount of pain is 0, is none. And, obviously folks who are living with chronic pain and have other things going on, that is a separate conversation, but like, you should not be in consistent pain because of doing pole. So this is a conversation I have a lot with pole dancers. So I'd love to get your perspective on that, pain and pole and aerial, and what does it mean if you're in pain constantly?
Yeah. So pain is generally your body not being happy with something, whether or not be overuse injury, an acute injury, or overuse injury. Generally, it's like, hey, there's something wrong. Let's take a look at it. The different types of pain. So a lot of patients will come and be like, hey, this is really sharp or this is really dull. Usually if it's a really sharp pain, that's usually a deeper injury, not more of a strain or a sprain. So if you have a really sharp persisting pain, I recommend seeing a healthcare provider to get that checked out. If it's a dull pain, but that's kind of constant, that's going to be more of a either overtraining or overuse injury. Conversation I have with my patients, and a lot I've noticed in the aerial and pole world, is that a lot of people tend to have high pain tolerances. And just because you can take a lot of pain doesn't mean that's a good thing. Listen to your body. Body can take a lot, but it's kind of a threshold. Once you hit that like plateau, and that's the point where your body kind of just breaks down, and that's going to affect your training, getting back in the studio. Your recovery is going to take longer, just a whole cascade of things, which is why I'm really big on prevention and maintenance and strengthening.
Yes, same. And I would say, just as a coach, if a student is working with me and they're like, I have a high pain tolerance, I'm like, I'm going to keep an eye on you. I'm going to tell you to stop when you're like, it hurts a little bit, but all the time I'm like, no, talk to a doctor. This is not, I teach pole to help people feel better in their bodies. And if it's making you feel worse, red flag, something's wrong. So you mentioned prevention would be your preference and also my preference as well. So what are some things that people can do to prevent injuries? Well, not necessarily just injuries, but like help to mitigate the risk of, hurting themselves, or if they're starting to maybe notice some signs, and maybe what some of those signs might be that like, oh, something is not going in a great direction here. What are some things that polars can change?
Yeah, so something you can do at home is TheraBands are your best friend. So a lot of those TheraBands, a lot of the conditioning exercises that you do, either at home, by yourself, or with a teacher. My favorite thing is, it's like, if you can't do it on the floor, you're probably not going to be able to do it on the pole or in the air. So it might seem weird, but training from the floor is really good for that. Active flexibility is going to be more important to train than passive flexibility. So when I have patients that come in and they're like, okay, what do I need to do to strengthen? Aerial and pole is all active flexibility. So when you strengthen that active flexibility, you're less likely to get injured as well. Other things that I like to implement are rest days. So know when your limits are. Don't push yourself more than you need to. And I generally recommend anti-inflammatory herbs or magnesium. Magnesium is your best friend. Magnesium glycinate and malate specifically for your muscles. And anti-inflammatories like turmeric, or you can even put tiger balm. Any of those things, those are great for at home. If you are starting to feel like tendonitis, which I see really commonly especially in polars, standard medical practice for tendonitis is rest, maybe a corticosteroid shot if it's really bad, but generally they're like, lay off of it. Well, new medical evidence is showing that it's better to continue strengthening exercises, rest, but not too much. You don't want to completely rest it. And also increasing vascular flow to the area. If you're wondering what tendonitis is, basically it's an overuse injury that causes little micro tears in the tendon. And the little micro tears over time cause a lot of pain and lack of mobility. I see this a lot in my patients. So when you have tendonitis, I recommend seeing someone who's specialized in physical medicine. I personally use a modality called fascial counterstrain, where basically it is a soft tissue manipulation therapy. It's not super rough like deep tissue massage, or if like chiropractic treatments or cracking kind of freaks you out. It's kind of a really soft middle ground. Basically what I do is I can figure out exactly which body systems are in dysfunction. So with tendonitis, I'm usually like, well, things are probably not draining properly. So let's take a look at the venous aspect. Let's take a look at the bone. Let's take a look at the muscle as well. So what I do is I literally drain the inflammation from the area. So that's something you can do on top of what you're doing at home to kind of provide that maintenance and that prevention aspect. And also, your coach and PTs and all that other stuff for strengthening.
Yeah, absolutely. And just to elaborate on a couple things you said in there, just in case folks weren't familiar or may have chosen to mishear something. So active flexibility is when you are using your muscles to move yourself into the position that you're looking for. Passive flexibility is when an outside force is doing it. So actively stretching your splits would be like your standing splits, where you fold forward and you lift the back leg, whereas a passive stretch would be just to sink down to it in the floor. And if you notice that, hey, I've got my flat splits on the floor, but my jade, like I can't get it flat, probably that indicates to me that your passive flexibility is greater than your active flexibility. And then when you said keep moving, I think some people may choose to hear, oh, if I have tendonitis, I can keep going to my same pole classes. And I would say reduce the intensity, work off the pole, do your off pole conditioning. Don't go back to doing exactly what you were doing beforehand that got you hurt in the first place, because tendons adapt way more slowly than muscles. And this is something that I see in my students as well, right? Especially, you know, wrist, elbow, shoulder. We can adapt those muscles fairly quickly, right? Like you can start to notice a difference in a couple weeks if you're conditioning consistently, but tendons are just going to take longer, which means that even though you may have the muscle strength to do something, that doesn't mean that all of your body systems are ready to do it. And it also doesn't mean that you have the proprioception and the spatial awareness with your body and the relationship of your body to the pole to hop into it. So particularly folks coming into pole with like you know, a very active background may feel a little bit like, well, why aren't you letting me do the thing that like I saw on Instagram that looks really cool that I think I'm strong enough for? You may be strong enough for it, but that doesn't mean that like everything together is ready to get you there, or that you have the pole vocabulary to come out of it safely, which, I mean, I haven't had a lot of students injured, but, you know, people in my sphere who have been injured doing pole, mostly it's been coming out of stuff and just sort of flumping down and catching stuff bad. So that's my pole rant as a teacher.
And I see a lot, especially with people who had a rock climbing or bodybuilding background, where they're really, really strong to begin with, but then they end up muscling their way into things. So a good example of that would be like a Russian split. Mm-hmm. So a Russian split, if you're doing it on a lyra, you end up having to do basically a skin to cat, but the skin to cat activates a lot of your abdominal muscles, those deep abdominal muscles. And in order to properly do it, you really need to activate those. And I've seen those in people where they end up muscling and injuring their shoulders because they end up for them arms. So technique and developing those muscles, I didn't know when I first started, but then as I progressed, I was like, oh, so this is why we do these conditioning exercises.
Yes, it is. It is not because your teacher loves to watch you suffer. It's because we love you and we want you to feel good and progress safely. At least for me, and for, you know, certainly the teachers that I've worked with. Maybe there's some sadists out there who are like, burpees for fun. Do it. I want to watch you.
I had when I was training my shoulder mounts on pole, I had a teacher that was like, pull the pole like you're lugging a sack of potatoes with a very thick Russian accent. It was great. I love the analogy. But I was also like, I feel like I'm about to throw out my shoulder doing this.
And if you I would encourage you as a student, if you were asked to do something by an instructor, and I'm including myself here, right, if any of my students are listening, and you're like, this feels bad, or I don't feel secure in this position, just don't do it. You're an adult. Just say no. And, you know, it is the duty of the instructor to respect that you have said no and to figure out something else that will be beneficial for you. No. So one thing that you mentioned when you're sort of describing your practice is that you work with hormones. And I know that this is something that I've certainly seen a lot of discussion of recently in like fitness education space. And I know that, you know, some of my students are at different places in hormone journeys and have their own things going on. Let me put it that way. I think that was sufficiently broad to cover everybody. But what are some things that you would think about, and when thinking about, you know, hormones, how might they affect pole? And when would you be like, okay, maybe I should see a doctor at this point?
Yeah, so that is a loaded question in one, because we can spiral down many rabbit holes. So for people who have cycles, I always recommend training around cycles. You know, when you're closer to having a cycle, I recommend going a little bit easier on yourself. But at the same time, people who may not consistently have cycles, I'm like, okay, let's take a look and see what's going on hormonally, because sometimes they're feeling really ick and they're getting enough nutrition, exercise, and sleep. So then I'm like, okay, that might be a hormone issue. Or I have cases where people, and I personally have experienced this myself, where we end up overtraining or training too much, doing more strenuous types of activities. And so when we do that, our body produces a hormone in our adrenal glands called cortisol. Cortisol is kind of like our fight and flight moment. So when we stress our bodies or our minds, our adrenal glands push out more cortisol. However, cortisol can basically, from DHEA, becomes cortisol or testosterone. I have noticed that people who tend to do more strenuous things like aerial and pole, especially if they have PCOS or any sort of like hormonal issues already, tend to shunt more towards that testosterone side. And so they start to experience, they feel like they have more energy, but then they get a lot of those increased hair growth, acne, irregular cycles, a bunch of other things. So that's something that I've seen a lot more, is that you tend to shift more towards the androgen testosterone producing with the training. I've also seen cycles being affected based on how hard they train versus how, well, not calm, but like then they take it easy. But generally it really is just depends person to person. Like hormones it's like a puzzle piece. It's very much a puzzle piece. I'm always like, listen to your body. For patients who are on hormone replacement therapy and everything, the common thing that I run into is patients want to look a certain way, but then they'll also feel a certain way based on the way we adjust the hormones. And we have to figure out a fine balance between how do you want to feel versus how do we get you to your goals as well. So there's a lot of, it's a puzzle. It really is just a big puzzle. And your best bet is to just talk to your healthcare provider to kind of figure out a kind of a hormone treatment plan for you.
Definitely. And keep checking in, it sounds like. So maybe keep a poll journal and take notes about how you're feeling in class and after class, and on your rest days. That can be very helpful as well. And work with your physician with that information, possibly to help fine-tune things, help feel the way you want to feel. So we talked a little bit about, sort of dull pain, sharp pain. If I'm training pole, what are some red flags, right? Like I've noticed a sensation and I stop immediately and I see a doctor as soon as possible. What are some things where you're like, that's like absolutely these things, do not keep training on them? I have my own list, but also I'm not a medical professional, so I may be updating it.
Those, since I specialize in a lot of pole and circus people, the number one thing I think of as a doc when it comes to physical injuries are broken bones. So generally, if you are pushing the area, say you have a shoulder injury or something, and you push that shoulder area and it is super painful, you cannot move it. High possibility of it being a fracture, especially if you can't move. Other things that I tend to look for are, can you lift that appendage? If you can't lift that appendage after previously being able to lift it, I would probably get that checked out. Something a little bit more, I guess, out there, but any like loss of like senses, like vision, feelings, that's a really big thing. Zinginess down the arm, that's what we usually call neuropathy. Usually isn't a bad thing, but when we're talking about our brachial plexus, we have a ton of nerves there. It's very, very unlikely you would end up like severing a nerve doing something like this, but nerves are not happy when they're stretched out. So that's another thing I look for. What red flags are there? I mean, systemically, if you're overtraining, and we call it hypertrophic cardiomyopathy, but really common in athletes and younger populations where basically they're overworking their heart, you can basically cause a heart attack. But if you're having any sort of like palpitations, sweating, profuse sweating, arm pain, classic almost heart attack signs, I would probably get your heart checked out too.
Yeah, and that would be like call an ambulance time if you notice that.
Call an ambulance. Broken bone, you could probably have somebody drive you, but any sort of like loss, like concussion, loss of consciousness, mean, if you're on a dance trapeze and you get hit in the head with that, that's a solid metal bar. So let's get you to the ER. Make sure you don't have a brain damage.
Yeah, and one thing that surprised me when I was doing my personal training certification was it does not take a lot of force to cause a concussion. So if you are in any way, like, maybe, better safe than sorry, right? Traumatic brain injury is very serious, and hasn't happened yet, knock on wood, with any of my students, but if it did, I'd be like, you're leaving class and going to the doctor right now. And that's just my recommendation in general.
I also like to include certain genetic or autoimmune conditions in there as well. Ehlers-Danlos, we hear that about that a lot in our kind of world, just because these people are super bendy and they can do all these things. But I always look at hypermobility as well. I mean, there isn't really like a set criteria for specific criteria for diagnosing it, but anytime I see somebody who has mobile knees, like I saw somebody doing the splits, normally your knees bend this way, theirs was like that, doing the splits, and I was like, don't do that, please. Because we don't want to snap tendons or ligaments or bones. So that's the other thing I tend to look for as well.
Yeah, definitely. And if you are hypermobile, I would, I have hypermobile students, and usually what I'm looking for in them when they're doing exercises is, I will say, visually straight for limbs, right? For example, in a handstand, your arms should look straight. They may not feel straight. And this is a situation where I would encourage somebody to use a mirror, or I'll yell at you. Some of my students listening are like, oh, it's me. I'm the one that gets yelled at. Because part of my job is to provide feedback to help you support your body in your journey. But there's also coaches who specialize specifically in working with hypermobile athletes and circus artists. I think I've heard that one of the diagnostic criteria is, can you touch the ground with flat hands while your legs are straight, which, I think in that sort of thing, like, if you have been stretching that every day for 4 years, probably you can do it, and you're probably not also hypermobile. So it may be worthwhile to seek out a healthcare provider who's familiar with performing artists or dancers or aerial athletes or somebody in that space.
And if you're in the Seattle area, so Dr. Emily Sherb is the circus doc. So she's really familiar with it. I'm also another circus doc. She's got a big list, but I know people who do the circus and aerial and pole, we tend to be a little bit bendier than the average person. So when I do a straight leg raise on somebody, which is literally on the table raising their leg, it's a medical examination to see whether or not it's nerves, muscles, or a disc pathology. You go to someone who isn't a circus doc, let's say your normal is like past 180, but you're only getting to like 150. Well, a normal doctor would be like, oh, you're totally fine. Like, what's wrong with you? Just go home and ice it, right? But you go to a circus doc, we're going to be like, okay, what's your normal? Because then we're going to base it off of that.
Yeah. So very important when, if you have the option, and I mean, obviously, I know many people who are listening to this are in the US, and rip, like, you may or may not have the option to work with somebody, but good to bring up. And also to be like, hey, photo on my phone, this is what it usually looks like, this is what it looks like now, I'm noticing a difference, these are my sensations. And just like with the pole instructor, I'd encourage you to advocate for yourself and maybe be a little bit stubborn. I think in my experience, most medical care providers appreciate if you are communicating clearly what the issue is. Put it that way.
For sure. And I also, from experience from a lot of the patients I see, like when they go to their primary care doctor, a lot of times they're like, oh, you need to completely stop and like not do anything. But it might also be worth getting a second opinion with somebody who, is a provider who does this aerial or pole, because they're going to have a better idea of, in actuality, what can you do instead of being able to stop completely. Because very rarely would I ever tell somebody to be like, you need to stop.
Yeah, and hopefully it would be also obvious to that person at that point, maybe. Okay, so we talked about some red flags, like, hey, absolutely not, this is, a big issue, go see a doctor, ASAP. But let's say I've been injured, or let's say I have tendonitis. What are some green flags? What are some things you'd look for to be like, you know what? You're probably good again. You can probably start easing back into things. And obviously, Dr. Hannah is not your doctor, unless she is. This is, general recommendations. This is not medical advice to you specifically.
So usually with any sort of injury, especially tendonitis, I'm looking for weight bearing. So how well they can do an activity with weight. So usually when you have tendonitis, any amount of weight, especially when you're pushing down against your palm, is going to aggravate it. But when you're able to lift something and you have tendonitis, that's usually a good sign when it's not hurting as much. The other thing I look at too is like wrist flexion, because really when you have tendonitis, it's really all of these muscles that are connected to the tendon. So how well can you curl your wrist and it not cause any pain as well?
And for those who are just listening, that is bringing the palm towards the forearm.
Towards the forearm, because normally with tendonitis, whenever we do resistance, so if this is your arm and you're pushing down weight this way, it's going to aggravate it. So when you're able to push it up and do resistance and not have pain, that's a really, really good sign. That's the main thing I look at for tendonitis, because that's really what most people suffer with, at least with the elbows. Shoulders are a whole different issue. Depending on what part of your body, it's a whole other issue. It's just very dependent. With shoulders, I'm looking at your range of motion. There's also a little bit more different directions in which you can weight load. So I'm also looking at how well you can do that. Whether that be in like, if you can do a pull up, like, is it causing pain or any other things? I'm also looking at general structure as well. So whenever I do a physical exam, I'm looking at passive. So if you've ever noticed, like, one shoulder might be higher than the other, sort of thing. So those are kind of things I look for as well.
Oh, definitely. Just shoulders are complex, but in general, you're good to go when there is no pain. The normal amount of pain is 0. Yeah, that's what you're aiming for. Oh.
And how do we do that? We slowly do weight bearing, weight loading exercises. And I recommend working with a PT or trainer for this. If you come to somebody like me, I generally don't do it. I will counsel you and send you referrals, but I generally don't do the actual strengthening aspect. I do more of the treatment and getting rid of the pain aspect.
And just to clarify, I know we also have some international listeners. PT there is physical therapist, not personal trainer. Dealing with injuries is outside my scope of practice as a personal trainer. I want to say in the UK they're called physios.
Physiotherapists, yeah. Yeah. And I think in Germany they're also physiotherapists. I don't know. Physical therapists.
But someone who is therapeutic, right? They're helping you handle, injuries, and not someone whose job is to help increase your general level of physical fitness. I think scope of practice is very important, but you know what it is and stay within it, and are reaching out to the right person for the right thing. And hopefully most people will tell you, like, oh, I can't, no, that's outside of my, what I can do for you there, friend.
Yeah. I would hope. If you have any questions, though, you can always get a second opinion. That's what I always recommend my patients. I'm like, it's always good to have second opinions.
Yeah, definitely. More information. Right, so I'm checking my various notes that I had. So one thing that you mentioned is obviously you have a background in both pole and aerial, and longtime listeners may notice that I've drawn a little bit more on the aerial side of things for guests for the podcast. And part of the reason is that in my experience, there is more of a culture of evidence-based practice in circus arts and aerial than there is in pole yet. I mean, we're trying to shift that, right? We're trying to be like, let's do things this way and see if maybe that's better for people. I mean, I think it is, but obviously folks are going to have their own values and opinions, and it's perfectly fine. But what are some of the lessons that you have noticed that are maybe more incorporated into the aerial world that you think the pole world would really benefit from?
Cross training. I was so resistant to cross training and being on a different apparatus when I first started pole. I only did pole for like the first 3 years. I didn't actually start venturing into cross training until maybe my last year in med school. And I never realized that cross training on different apparatuses immensely helps in your training and getting stronger as well. So in my personal journey with pole, like I was hitting a plateau when it came to like strength. Like I was struggling with inverts, shoulder mounts, all of the typical power pole stuff. But then I started training on Lyra. And so I realized I got a little bit stronger and I was like, oh, I'm really, really strong. But then I tried silks. If you want a really, really good across the board, just want to get stronger, active flexibility, passive, conditioning, everything, I highly recommend silks. And it's very, very gentle on your joints. And in terms of injury, it's honestly less I've seen, but cross training is your best friend. I kind of regret not cross training for the longest time.
I would also highly encourage folks to cross train. And folks who train at my online studio, half of my classes are cross-training classes. And obviously I'm not asking you to hook up a Lyra. I just teach pole and off-pole stuff, but it's really, really important, and it's good for your brain. It's good for your body. And even if it, feels a little bit like eating your broccoli or taking your medicine, I promise it'll help. I promise it'll help.
And then go back and take beginner classes, because a lot of the foundations, so something I found that kind of more common in the circus world, I think, in the aero world, is that when you start out on an apparatus and then you kind of get to the intermediate and advanced level, when you go and start training on a totally new apparatus, because of that background, you end up accelerating a little bit faster and you kind of get put immediately into almost an intermediate, but you don't get the basics and the foundations of everything. And I would encourage everyone, no matter what, if you're doing a new apparatus, if you're wanting to review and do things, go back to the basics. There's a reason why there's a foundation in the basics.
Yeah. I think the challenge there can be, especially for pole dancers, a little bit mindset. Because, and this is very interesting, because this has happened while I've been doing pole, because I started in 2012. And when I started, folks were doing some stuff on YouTube, but like Instagram pole wasn't really a thing yet. And there's been such a big shift in what it means to progress in pole, where to a lesser degree in the past, it was, here's the list of tricks I want to get, and I've gotten them. And I would say now, especially when I'm talking to folks who are newer to pole, that is very much the mindset, is I want to do, these 50 things. And like my progress in pole, the way that I feel that I have made progress is that I have done these 50 things. And I don't have good, causal evidence for this, so I'm going to step back from saying that, like, I think that has caused some things, but I certainly think that it can make it harder as a dancer, if, like, that's what feels like success to you as you learn a new thing, to be like, oh, what would be good for me would be to focus on finding a better feeling way of getting into this movement, right? Or making it smoother, or, playing with it and finding variations with it, and really having a very, very solid foundation with this one thing and a lot of things that I can do from it, rather than learning 80 new things. And I think that's just a challenge for folks who are in that place right now, and they're like, new trick, new trick, new trick, new trick. And what I've also noticed is that, and of course, there's latent variable of time, but there's, the other variable of how long have you been doing pole. And I've noticed that people who've been doing pole for a while, eventually they get to the point where, like, oh, I know more things that I could ever possibly put in a piece, right? Like, I have like this Rolodex of things I can do. That's not actually the thing that is most valuable and important to me right now. The thing that's most valuable and important to me is, how can I put them together? How can I find flow? How can I find fun? How can I combine them in new and interesting ways? And that doesn't happen for everybody, but I have noticed that sort of general pattern as folks get more mature in their pole journey. So, but yeah, it is challenging, but if that is how you see progress, but it is good to really dial in on the foundations, really dial in on the basic technique, right?
And I will say that I feel like, at least from my experience with the studios I've been to, whenever you're really struggling with a trick, A lot of times they're just like, keep doing it, keep doing it, keep doing it, but then you end up getting injured. And usually there's a reason why you can't quite get the trick, and it's really helpful to work with a pole instructor or trainer or someone who can help you break down and help you condition to get the trick. So that's something I've been educating a lot of my patients on, because I feel like the mindset is just, if I keep practicing this trick, if I keep trying to do this Aisha, well, if you keep doing that Aisha and it's starting to hurt more and more and more, you're going to end up seeing knee tendonitis. So
yes. For those of you listening on Spotify and not watching on YouTube, I just made a bunch of faces in a row because as an instructor and as a personal trainer, that is one of my single biggest pet peeves in pole instruction, right? That would be the equivalent of, client comes in first time, they're in the gym, and I'm like, great, pick up 600 pounds. And they can't do it. And I'm like, well, just keep trying to pick up 600 pounds. No, you ask them to pick up 20 pounds and then you build up to there. And this is an aside, and this is going to be me being sassy. If you don't understand the fundamental components of a pole move in a way that you can both regress and progress it for different students, you've got no business teaching pole. You don't understand the apparatus well enough. You need to step back, you need to learn, and then you can come back to teaching. And I feel very strongly about this, and I'm just gonna, if that landed for you, maybe take some time and think about it. And if it didn't, great.
I always emphasize stability too, because you need to be very strong and stable in your movements. If you are precariously hanging by, if you're not able to control it 100% or at least 90%, and you're kind of just forcing your way into it and you feel wobbly, that's not safe. I would not do it more than once or twice if you're training. Yeah. Stability is a huge thing that we talk about, because especially in flexibility, you can be really, really flexible, but are you stable in that? Mm-hmm. Another thing, I always forget her name. Circus Mobility, I believe, is her tag on Instagram. Maybe. She talks about breathing as well. She talks about how you don't really own a movement until you can breathe through it. And even I struggle with that a lot. So that's something I've started incorporating with my patients and students as well, is breathe.
Yes. Jessica John, yes. Circus Mobility on Instagram. Yes. Also a very good account to follow. I'd recommend it. Can you breathe? I think a lot of dancers have a goal to flow, and can you move in and out of it smoothly? And also something that I'm looking for, particularly if you're working in a new movement or you're working on a foundational movement, I'm like, okay, are you ready to start building on top of this? Can you do it 6 times? Can you do it 8 times? Can you do it 10 times? Maybe not necessarily in a row, but in a single training session, and have each one be really solid, because that tells me that you have the strength for it, you have the flexibility for it, mobility probably, you have the endurance, and you have the understanding of the movement, that as you begin to become more and more fatigued, you can still find it consistently. And if you're not there and you're really, really struggling to do something consistently, and you want to start building on top of it, maybe draw back a little bit, maybe find an intermediate movement that is going to be more accessible for you. Work with a coach to find that. But I know none of us want to go slow. I know we all want to have TikToks with our 10 new moves, but I also want you to be able to reach overhead when you're 80, right? That's an important goal for me, for you, my students.
I see frozen shoulder a lot too. I specialize in a lot of shoulder, neck, shoulder and stuff, which is most common in our worlds. But the beauty, so I actually ran a space at a pole studio here in the Seattle area. So the beauty of being able to see patients through there is that they can show the moves or whatever that is causing discomfort. And generally, I kind of have them hold it for a little bit and be like, okay, tell me what's going on with your body. Because a lot of times, unless you're doing ambient or something, we don't really hold our moves for a really long time, and we don't realize the strain because we have a lot of that adrenaline pumping through us. So that's something I personally do as well, just to kind of get a sense of what's going on. How do you feel? Actually feel.
Absolutely. A good litmus test for me, for dancers, I posted about this on Instagram a while ago, is can you hold an inside leg hang for 40 seconds. Like, I would not necessarily expect that of everyone, but if you are, really looking to begin to do, longer aerial combinations, if you really want to start stringing things together, like, I'm looking for that endurance and that comfort in the position before I'm like, okay, yeah, let's do, 80 things in a row.
Yeah. And this is where, if you're training, I highly recommend booking a massage or doing fascial counter strain or seeing a chiropractor or whatever, like once a month at least, because your body takes a beating from these. And a majority of people I go to classes with don't even take care of their body, and then they end up developing more injuries.
Yeah.
And, doing pole and aerial and circus is kind of like your getaway from life. But also remember, you gotta take care of your body too. So self-care. It's important.
Yes, absolutely. And hopefully you are in a training situation and you're working with, coaches and professionals who are encouraging you to do that, right? Like, I have, again, some of them may be listening. Hi, straight up told students, I don't want to see you for a month. You need to take a long break. Things like, things that I look for when people start to talk about overtraining. If you're feeling a lot of frustration that you don't usually feel, if there's a strong emotional component, low mood, right? Like, these are all things that I'm like, obviously there could be other things going on there, but if you have been increasing your movement, you're starting to notice these emotional symptoms, that tells me you gotta dial it way back. And yes, I get that pole is your fun escape, but also have another hobby. Add one more thing that is not as taxing on your body, right? If you've been training and you're not seeing any gains, or you're seeing regressions, if you suddenly start to lose strength, if you suddenly start to lose flexibility, that tells me you're absolutely overtraining. You got to cut on back. Even if you're not feeling pain, right? If you're just not continuing with the velocity that you did have previously, or you're going down and you feel bad about it, that's an issue. If you don't feel bad about it, right? Mood is great. You feel fine. You're doing what you did. You can still do what you did. You're not really interested in continuing to gain strength or work on a specific flexibility move. That's fine. That's just you've adapted to the level that you're training at. That I'm not worried about. If you're happy about it, if you feel good, it's probably fine. Yeah.
Always listen to your body. Listen to your body. Headaches are not normal. I've had patients where they're like, I have a headache every single day. And I'm like, how long has this been going on? Because no headaches is supposed to be the norm, okay?
Yeah, there's a Star Trek episode where Beverly Crusher says that, and I was watching it at a point when I had really bad cluster headaches, and I was like, I should see a doctor. And as it turned out, I had really bad cluster headaches. Yeah, there is a reason that you are in pain, and ideally you can address it. Well, lovely. All right. Well, I don't want to keep you too long. This has been a really good discussion. We talked about, some of the things that you tend to see with pole and aerial artists. We talked about, red flags, the things like immediately go see a doctor. We talked about some green flags. So basically, if you're not in pain anymore, have at it. We talked a little bit about hormones, maybe keeping a journal, talking with your healthcare providers. We talked about, I'm checking my notes, the importance of cross-training and active flexibility and supporting your joints. And we talked a lot about tendinitis, actually. So if you are, if you're noticing any of those symptoms, right, like pain with pressure, other things, can you remind us of the symptoms again?
Yeah, so tendonitis, pain with movement, especially with load, like any sort of weight loading bearing, tenderness, like super tender palpation, like if you're poking somewhere and that freaking hurts. Decreased grip strength is usually another one I see. And yeah, that's pretty much the big ones. And more mild cases, you may not notice it unless you're in certain positions. And unfortunately, pole is not very conducive to ergonomics for the body. And so, when you're doing a, forearm sort of push on the pole, you may feel it more there versus doing a caterpillar up or something.
Yeah. So things to look out for if you're noticing those things in yourself, see a doctor. And don't just keep pulling on it. Don't just keep dancing on things that already hurt, because you're going to make them hurt worse. And worst case scenario, you lose a large part of your mobility, right? Like you do yourself permanent damage that means that you can't do pole anymore. And I wish I could say that I'd never known that to happen, but I have. So take care of yourself.
And I treat a few professional performers in like the Seattle area. And yeah, every time I work on their bodies, I'm like, you gotta take care of yourself. So I do a lot of death drops and a bunch of other things in high heels. Yeah. So come see me or come see a circus doc, preferably someone who specializes in physical medicine or sports med. That's a little different from an orthopedic. Orthopedics are more bone related. Generally, it's a referral to an orthopedic, but chiros, PTs, sports medicine, physical rehabilitation, physical medicine inclined NDs, they usually say on their bio, but yeah.
Get you some help and support yourself. So if folks wanted to find you, where would they look?
Yeah, so I have a private practice here in Seattle area. acemedseattle.com is the link, and I'll give you the info as well. I also work part-time at a clinic in the Puyallup area, so if you're in the further down south, I see patients down there. That's where I take insurance as well. But yeah, that's currently where I'm at.
Oh, absolutely. So Seattle folks, look up Dr. Hannah and, take care of those things that maybe you've been putting off. All right.
I'm also active on Instagram. I can also give you my Instagram handle, but feel free to shoot me a message on there or anything if you have any questions.
Great. Thank you so much for joining today. I think this has been really helpful and really nice to have the medical perspective on it. Thank you to all my listeners for joining, and I will talk to you next week. Thanks so much for joining today, Pole Dancer. This podcast is a production of Slink Through Strength, the inclusive, evidence-based online pole studio. So if you're looking for a place to train, either off-pole conditioning and flexibility, or learning pole tricks and refining your pole movement, you can find us online at slinkthroughstrength.com.